see yourself, right?
Yes, I
The
can see myself.
so how you doing? How was your Sunday?
Fine, thank God.
You went
I'm
to
so
church?
excited. Yes, I did. You did?
I did not go because of how far our church is. So sometimes I just feel like staying at home, but most times I also go to church. So
Okay,
which
but
church
you
you
like
went?
stream. You
Eh?
stream live.
No, I do go to Dunamis. They are this thing church, but sometimes we stream live also when they have
Okay,
their main program.
okay.
So
Which
what
church
about
is that?
and Dunamis?
Okay, me, Deeper Life.
That's my former church. Oh.
Really?
you can you can see the mark here.
Okay.
I was
Let's
born
see.
and raised in Deeper Life, so that's
Wow.
the would I say the that character is still there. Is still there. It's
I
not.
see, I see. Okay, so how will we do the moderation now? Like,
Okay, we talk now. I'm
okay,
just waiting for my audience to start coming. Once I see one person, then we come. I'll
okay,
talk about. I'll
let
talk
me
about.
send to the audience too.
You will talk. I'll also talk. I will first of all talk about digestion, how food is digested, how the body assimilates food, the way insulin works. You understand? How eating this thing. Then you can explain because I watched one of your video on how to calculate for insulin resistance. You understand? Because you made a video like that there's no particular machine that can actually measure insulin resistance. So you can explain any part of insulin resistance, anything is related to insulin resistant, anything you know about it, just say it. You understand? It doesn't, even if I've spoken it, then you can just say it. Anything you know about insulin. So I'm just waiting for, let me just see one person, then I continue. If you're joining my life, you're welcome. We are talking about insulin resistance, how someone can develop insulin resistance without knowing. Some of us, if you see someone having diabetes. Diabetes is a metabolic disease. You understand? It's very, very dangerous. It doesn't have cure. In fact, when you have diabetes, you have to manage it. And someone can have diabetes for years. I mean, can have insulin resistance for years without them knowing. So, how do someone develop insulin resistance? Now, for you to know if before that, you have to understand the work of insulin in our body. Now, I'll start with digestion, just a brief explanation on how digestion works. Now, when we eat, particularly carbohydrates, you have to understand that digestion starts from the mouth. The mouth releases salivary amylase to help break down carbs, starch into maltose. You understand? Then also your teeth helps to break down when you chew this food, it helps to break it down. Then it travels to your stomach. In your stomach, digestion of carbohydrate don't happen much in the stomach. Just slight digestion and small digestion that happens in the stomach because the stomach acid, which is hydrochloric acid, neutralizes the effects of this salivary amylase in the stomach. So the stomach is like the temporal storage of carbohydrate of food. Where the digestion of carbohydrate takes place majorly is the small intestine. Now, this food is moved to the small intestine where the pancreas releases pancreatic amylase to break down these carbohydrates into smaller glucose called monosaccharides. Now, monosaccharide is where you get your I mean, into break down this complex carb into smaller glucose called monosaccharide. Now, monosaccharide is where you get your glucose, your fructose, your maltose. All these are classified as monosaccharides. Now, in the small intestine is also where absorption takes place. Now, you need to understand that when you eat, food is absorbed into your bloodstream through your small intestine. And when this food is absorbed into your small intestine, the blood sugar spikes up. Anytime you eat food and it's absorbed into the bloodstream through your small intestine, the blood sugar spikes up. Now, what happens in your body? Our body is designed to control this sugar because when you, our body and the blood is not supposed to contain much of sugar. This is where diabetes comes in. People that has diabetes is because of their blood sugar is much, because sugar level in their blood is too much. I don't know if you get me. I don't know if you understand. Those sugar in their blood are not moving into the cells of the body. That is why you see someone that have diabetes is very lean, weak. Some of them self cannot walk. If you have someone that have diabetes, just notice some of these symptoms: weakness, lean. They eat oh, but just that the body cannot utilize those glucose. The reason why it's like that because this glucose is stored in the blood. So when the glucose is assimilated from the small intestine to our bloodstream, this our sugar level spikes up. Now the body normalizes this through hemostasis by the pancreas. The pancreas releases insulin through the beta cells of the pancreas. The beta cells of the pancreas sugar. Insulin is a hormone that facilitates the uptake of sugar from our bloodstream to our cells. So when the pancreas releases this insulin into our bloodstream, it enters the cells and unlock those receptors. Receptors are like doors. So it binds to the receptors of our cells, unlock it, allowing glucose to enter into our cells. Now, when enters into our cells either uses it for energy or it stores as glycogen, either in our liver or muscles. I don't know if you understand. So either our body utilizes the cells or it stores as glycogen or it stores as fats. Now, in the case of fasting, when you don't eat, I don't know if you when you don't eat, when you are fasting, you realize that you don't eat. What the body does is that it goes and breaks down this stores energy, which is glycogen, that is stored in your muscles. Because these are muscles can store energy and start breaking it down. Even the fat in our body start breaking it down when our body is under the state of fasting. Now, you have to understand the work of insulin when it comes to regulating our blood sugar. And this is what people don't understand about insulin. You can have insulin resistance without you knowing. Your eating habits can cause insulin resistance without you knowing. Now, our body is designed to eat at least 3 square meals in a day with a space of 6 hours. Some persons, when they take their breakfast in the morning around 8 a.m., they take snack around 10 p.m., they take another lunch around 1, then they snack between 2 and 3, then they take another dinner around 6, then they start snack again around 9 p.m. When you have such kind of eating habit, you have to understand that you are harming yourself. The reason why you're harming yourself because anytime you eat, the body releases insulin to regulate this blood sugar. So insulin will be constantly spikes up. The body will keep on releasing the insulin to make sure that it regulates this blood sugar. It regulates what you keep on eating. There is no time for the insulin to calm down. There's no time for the insulin to relax. Insulin takes at least 3 to 4 hours after it spikes up to calm down. This is why you shouldn't eat like every time you are eating, even if you snack. Some person will call it healthy snack. My dear, there's nothing like healthy snack. Once you take your meal, give your body time to rest. Give your insulin time to calm down. Because when that insulin keeps on spicing up, going up and up and up, there will be a time that your body become, will I say, less responsive to it. Your cells become less responsive to it, and your pancreas will keep on releasing insulin, and your cells, the cells of your body will not respond to insulin again because it keeps on knocking on the door, it keeps on knocking, it won't respond, it won't take it serious. And if this continues for years, this is how it results to insulin resistance, because the cells of your body is not responding to it, because that too much spike of insulin, that too much surge of insulin, no time for it to come down. You eat every two hours in a day. Every time something is in your mouth, your insulin keeps on, the body keeps on releasing insulin, keeps on spicing up. There's no time for it to come down and normalize. So this is where insulin resistance comes in. And from insulin resistance, it can migrate to pre-diabetes. From pre-diabetes, it can migrate to type 2 diabetes. Now, in type 2 diabetes, you have to understand that the body is less responsive to insulin, and it will come to a time that your pancreas is unable to produce insulin anymore. That's why I see some persons, they inject themselves insulin. I don't know if they have to rely on insulin injection to live, because the body cannot produce insulin again. So that is how insulin resistance comes in. So I don't know if you have any question, you can drop it in the comment section. Now you have to understand we have type 1 diabetes and type 2 diabetes, but I'm not going into that right now. You understand? Type 1 diabetes is an autoimmune disorder where the immune system attacks the beta cells of the pancreas. That's the pancreas that produces this insulin. In such cases, the immune system sees these beta cells of the pancreas as an antigen and attacks it and destroy it. And that type of diabetes is categorizedly majorly happens during childhood, like young age. You understand? Then for type 2 diabetes, is more like a lifestyle disease and also is genetic. You understand? Type 2 diabetes is a lifestyle disease in the sense that even if it's genetic, genetics is like a gun, while your lifestyle pulls the trigger. You can have this type of metabolic condition in your family, but if you don't take it action on yourself to control yourself, you might see yourself developing diabetes over the years. So you don't blame it on gene. Also blame it on your lifestyle habits, because this is one of the habits people go through. They do it all kind of without realizing that their eating habits can actually cause insulin resistance. And from insulin resistance, it can result to diabetes, from pre-diabetes to diabetes. So that is how it is. My Please take over. Talk something.
Okay. Thank you so much, this health. I'm so pleased to join you live.
You're welcome.
Okay, when I first, started learning about this was when I stumbled on one of your videos, and that was when you mentioned what you just shared now,
Yes.
spacing your meal. I'm someone that snack, and then although you sometimes you say we are snacking healthy, we are taking just fruits in between, but I learned that all the same, though it may be healthy snacking, it can
Yes.
also
They're the same
keep the
thing.
insulin. And because I have someone who is consistently, she's already having type 2 diabetes,
You
but I
see?
always see her snacking,
That's one of the
snacking.
reasons. Yes. That's one of
Yeah,
the
so I
reasons.
gave her that counsel so that it could help manage it because It's like skipping a dose for her drugs can be, she starts having those symptoms, so she can't see clearly and the rest. So she was complaining to me about it.
Diabetes can of course can affect the eye also. You
Yeah.
understand? Diabetes can affect
Yes.
the eye, can cause issues. But when you have diabetes, it shuts down even your kidneys. Diabetes is a disease that is very serious. In fact, there was a video I watched online where a a doctor was like, if they should ask you to choose between having diabetes and having HIV, which one will you choose? And the doctor said, I rather have HIV that have I'm being serious, that choosing diabetes. That's how serious it is. That's how
Wow.
people don't understand. That's how serious. When you have diabetes, your kidneys are on would I say on risk, your eyes, the organs in your body are
Body.
shutting down. You understand? Because when there's too much glucose in your blood, there's issue your heart. So having diabetes is an issue that people don't really understand. People don't really know. They blame it on gene. They blame it on genetic, forgetting that even if you have someone in your family that suffers from diabetes, you might have that gene. You understand? But you should
Yeah.
not blame it completely on the gene. Gene is just like a gun. When you have a gun, does not mean that you kill the person, right? Then your
Yes.
lifestyle, yes, your lifestyle habit is the one that pulls the trigger. So how you eat, what you eat late, you consume anything, carbs, high in calories, all those things can cause issues, can cause pre-diabetes, diabetes. So continue,
Yeah,
just
so
listen.
I wanted to add this, like, why is it is mostly missed, this insulin resistance? Some people will just like in the hospital where I work, once you say, okay, we want to check your fasting blood sugar, I say, no, I don't have sugar problem. And maybe you check, truly, the readings are normal, within our usual normal range for
Mm,
fasting blood sugar or random. And they say, yeah, I told you, nurse, that I don't have sugar, I don't have sugar. And I'll just smile because there are certain signs we are seeing already that is prompting us. So sometimes why it is mostly missed, like people don't get to catch it early, insulin resistance, is because since the insulin is still overabundant in the blood, it kind of regulates it and it makes the person seem to be, the blood glucose level seems normal for a time until it becomes resistance. As long as it's still there, it can make it normal. And then some symptoms they say, like cravings, sugar cravings, and so on.
yeah.
Those symptoms are not clear because they can be attached to so many other things. So
Yeah.
those things makes it difficult.
To
Now
detect.
somebody you checked, he has a number. So what are you saying? Like, nobody wants to listen to you anymore. Like, so that is the main reason why this insulin resistance is not, because it can be in the body, it can be happening slowly until,
Exactly.
yes, it's just come to an end. And as at that time now, it becomes an issue. Like you mentioned, they now have to take the injectable insulin. I don't know
Yeah.
if you heard the story of that young lady that passed on because she couldn't get to her insulin. That it was a university student, I think university of,
Seriously. Just share the story.
yeah.
If just share
Okay,
the story.
okay. She's a student of, I think she was studying mass communication or something, but in Chukwuemeka University, that's Anambra State. They
Mm.
changed the name of that university. So formerly it was Anambra State University. They changed it to something like that. So, but I saw the news and okay, for her own case, she's a type 1 diabetic
Okay.
patient. And so she has been on this insulin from childhood. And then this insulin has to be stored in the fridge to
Yes.
maintain its potency. So in her room, she stored it there and left for classes, but misplaced
Wow.
her room key. Now in the hostel, there is a rule that if you misplace your key, you have to pay 200,000 naira to the porter, be to an account, then before the porter will release the spare key of the hostel to
Hmm.
open the room. All those protocols are there. All those ones now are normal to make people to be more careful with the key, right?
Yes.
She
Yes.
couldn't access the room. So, but now it's supposed to be an emergency because they had to tell the porter that please, she can't stay without this thing. She's already started, feeling like almost going into coma and the rest. So they were pleading and pleading. According to the story, the porter just ignored them and said until they pay the money. They say they don't
Just
have the money. Where will
uh,
they find? They started making calls and the rest, but the woman was adamant until the lady collapsed. Now it's now when it was when the lady collapsed, she now went to open
to
the door. So that like, is this on witchcraft or something? She now
and
went to
nobody could break the door down because it's an emergency now.
there are
Wasn't
certain
she?
doors they build these days that before you break the door, it takes a lot. So
Mhm. I think in such kind of cases, because I realized that in this Nigeria they don't really take things as emergency as it should, even in the hospital. Now that's why I advise patients to act extra. In fact,
I mean,
if yes, if not just when you are going to meet a doctor, in such kind of situation, and you know that your life is at stake, if it's possible for you to fake fainting, just fall down and start so that they will
to
take
me,
it to you.
what came to my mind is that is not the only that her own insulin is not the only insulin in Nigeria. So she would have just outsourced, get a jab of it somewhere, as long as it's suitable ones that matches what works for her, even if it's the short acting, whatever. But at least she has gotten a temporary relief before they start pulling her
Yes,
with the
exactly.
woman. Yes, because do you know at the end of the day, okay, she collapsed. They rushed her to the nearby hospital, started developing complications and the rest. Her kidney, of course, just
You
knocked
know
off.
something about all these
Four
deaths.
days, she has passed on completely. In 4 days, like she was in coma for
Ah,
4 days then. So the students went on riot and the rest. But to me, I felt like, come on, they would have done more. Although they were like, the woman will be arrested, she should be in prison, she this one, that one.
someone
But
that
you
has
know,
gone is
Nigeria,
gone. Someone that is
that's
gone is gone.
they would have just pulled her out to a different place, to me, my own view, and then she would have taken insulin from any nearby facility. No matter the amount they pay for it, she
It's
gets
just
it.
like asthma. You know
Yes,
how asthma patients normally act when they need that
yes,
inhaler.
yes.
It's the same
Yes.
thing as when someone needs insulin urgently because the body doesn't joke with you when it comes to that. When the sugar level
Another thing spikes that
up.
came to me, for asthma people now, they can easily carry their inhaler around, but
Yeah.
because insulin has to be freezed. So I started browsing about it. I saw that there's this kind of pack made of silicone that you can actually store the insulin for about 18 to 20 hours and it will remain cool. You get after
Why did she forget to carry it to the school now? Having such kind of condition, you don't have to
maybe
bring
she
it
doesn't
up.
have where to preserve it. At certain temperatures, it would no longer be potent. So,
Yeah.
but that pouch, I saw it online, sold outside the country. You have to import it. The pouch can preserve that insulin. I think foreigners invented it because imagine you are traveling, you can't carry your freezer or your fridge around. So it's that one you hold at least temporarily to preserve it till you get to where you can put it inside the fridge. So
Oh,
that's another option that should be, but it's not common in Nigeria. Most people rely on fridge, so they have to be close by where they can access fridge. But that one,
even the fridge is there 24 hours electricity.
no, but the fridge still stays cool for some time. Like
Yes,
even
but
if
that's true.
it stays cool for some, it doesn't need so much freezing like the vaccines. No, it
Mm.
doesn't need so much freezing, but it needs a temperature that is lower than atmospheric temperature. Well, it was really painful hearing that anyway, but I don't know how justice prevailed over it. But I know the girl's parents. I think she was even the only child, or maybe
Hi.
the story wasn't nice at all.
That's really painful.
It wasn't nice, but well.
So that's the reason why diabetes is not something that should be joked with. You understand? And many people overlook this. When you ask some persons, when last did you go for tests and check your sugar level, they don't know. At least when you check your sugar levels, there's some certain kind of reading that will at least tell you that it's time to cut down on some things. Some persons cannot go a day without drinking Coke, all this carbonated drink. And you see them snacking every day, snacking between meals. When you tell them, they say it's healthy snack. That your healthy snack, when the body start breaking it down, you call it fruit, abi? When the body start
Yes.
breaking it down, it still marks to glucose.
Yeah, yeah, that's true.
Yes,
True.
now it still marks your glucose, and is that glucose is what the body will absorb, because the body cannot absorb anything. You understand? It has to break it down in a way that it can be absorbed, at least monosaccharide, fructose. So it doesn't matter whether you are eating healthy snack or what. When you keep on eating every hour of the day, you keep on spiking your insulin. Your pancreas keep on releasing insulin, and that insulin surge goes up, no time to comes down. When it's like that every day, from time to time, when it's like that every time, from time to time, it it progresses to insulin resistance, because your cells become responsive to it. Just like when someone is knocking on the door, insulin, okay, insulin is just like a key that opens the door of our cells. You understand? Now, when insulin keeps on knocking on the door, please open, open. I need to bring in glucose. So every time he's knocking on, he's knocking, he's knocking. There will be a time that the cell will be like, insulin is not serious. Every time he's knocking on the door, he's knocking. You understand? So that is where it becomes less responsive to it. That is where it becomes less sensitive to insulin, and this is what results to insulin resistant. So I don't know, can you like give like how someone can measure their insulin? Is there any advice on that? Like,
Okay, okay. You've earlier mentioned on the control, which has to be dieting, spacing diets, like
yes,
at
at
least
least six
4 5
hours interval.
no snacking, no snacking. Another alternative is completely eliminating any processed food can help prevent it. But to check for insulin, there are tests to do it. There's a fasting insulin test. If you go to the
Okay,
lab, you tell them you want to do a fasting insulin test, they will do it. They'll take sample, blood
are
sample,
they supposed
same
to
day.
eat? Are they supposed to eat when going for the test, that
No, no,
fasting
no.
blood sugar?
It should even be done before 8 a.m. Like anything before 8 a.m. So it should be early, arrive early at the lab, they take your sample and then you've not eaten anything. Then they
Oh,
go check the results. Because there's another one they call HbA1c. That one actually does it shows it at a late stage when insulin resistance has gone so far. So this fasting insulin test is the most potent one, since the fasting blood sugar test does not really show it, because it can be showing a normal reading, but the fasting insulin is one to tell you that you have high levels of insulin. You know, when you like do all these urinalysis, then they will now do a
yes.
comparison.
Mm.
A normal insulin should be between what level and this level, and they will compare it from the last time you ate. That should be the day before, and then this time they did the test, the duration, and how much insulin. If the levels are very high, then it could be that you are beginning to have insulin resistance, but it
Insulin.
is still it's still
It's
reversible.
reversible. Yes, at
Reversible.
that stage, you can easily reverse it, because
Yes.
the pancreas is not destroy your this thing, your cells. So that, and one thing people have to understand is that if you watch where people that have PCOS, they tend to have this insulin resistance. That is why in some cases of women that have PCOS that stops it,
PCOS, that's polycystic
ovarian
ovarian
syndrome.
syndrome.
Yes.
Okay.
So one of the drugs they normally recommend for them that helps them for ovulation and also to help regulate their hormone also is metformin. Metformin is one of
Okay.
the drugs they recommend for people with diabetes. You understand? Because
Yeah.
people with PCOS tend to have insulin resistance. So this insulin resistance messes with their hormones, messes with their cycles, messes with their ovulation. That's why someone with PCOS, some of them will not see their menses for 6 months, some years, some it comes and goes, it's not regular. Some might even see their menses and it's not, they can't ovulate. So they recommend metformin, which is a drug for diabetes. Oh, that is how serious having diabetes is for women that have PCOS. I'm not recommending any drugs, but I'm just saying that having diabetes plays a role in so many things in your body. Having insulin resistance plays a role. Even as a woman, it affects your fertility. It affects your fertility. Insulin resistance messes with your hormone. it does a lot to our body. So that is why we should avoid anything that will make you become either pre-diabetic or having diabetes. It should be taken seriously. So being on life where someone would prefer to have HIV than having diabetes,
Yeah,
that
every
should show
time
it has serious issues.
that's serious. So come
You
on.
understand? That
Yeah,
should show
yeah,
it.
yeah.
And funny enough, diabetes doesn't have a cure. I don't know if maybe they any modernize this thing, but judging from what
There's
I've
no
read and
cure
based on,
per se, but
yeah,
there's it's just managed. There's no
yes, it's
cure.
managed.
It's just managed. Yes.
Exactly. Exactly. It
Lifelong
doesn't have a cure.
management.
It's a manageable condition, just like hypertension. All these type of condition are
They're
condition that doesn't
chronic.
have a cure.
They're
You
chronic
manage it,
condition.
manage it, manage it, and as you're managing it, the organs in your body are also shutting down. They will give you medications. The medication is just to help you to stay alive. It's just to manage you.
That's
It just like so that's like you have to it's just add more.
okay. I discovered that people who lack sleep, maybe due to these days things are really not easy due to inflation everywhere. People are trying to
Yes,
job,
now
job
stress.
on several jobs. So only
Mm.
one person is doing like three, four jobs to make ends meet. And if you meet such a person, hardly sleeping, works nights, day, like that. I often tell my colleagues that see this double shifting and triple shifting people are doing. So that you don't break down. I don't know how you'll be working 24 hours around the clock.
Wait, so you people work 24 hours in the hospital? Like
It's
they
not ideal, but all this kind of negotiations so that I can
I
meet up with this.
I thought they
You know
do
that
shifts. At least shifts should be at least
yeah, they are standard shifts, so morning, afternoon, and night shifts. But now let's refer to this individual. Let me call the person Ada now. Ada has two other engagements she wants to meet up. So because of that, she wants to cover somebody else so that the person can, that kind of thing. Like I want to
yes.
fix it so that you will fix in my own time. I will now be away doing. She's not resting. No, she's doing another job. So she's doing multiple shifts. Me, I told them I wouldn't break down, so I'm not
Then
doing
later
that.
they will now shift it to someone else.
That's it. So
Okay.
now I discovered that if sleep is corrected, like you have adequate sleep, it can reduce this insulin resistance to about 25%.
Of course
So
now.
sleep goes a long way,
The
aside
re-
diet control.
yes. And the reason why sleep plays a role in helping also is because of cortisol. You
Yeah,
understand? Now, if I'm not wrong, cortisol is one of the hormones, is a stress hormone. So when you stress yourself much, the cortisol rises. You understand?
okay.
And this cortisol is also a waking hormone. That is why when you're about to sleep, particularly around that period of 8, 10, and you have anxiety issue. Some persons maybe something happened to them, they start having depression, anxiety issue. You find it difficult to sleep. You are stressed. The reason why you
Yeah.
cannot sleep is because of cortisol is high that period. Cortisol is not supposed to be high during our sleep period. You understand? Because there's
Yeah.
another hormone that controls sleep, which is, if I'm not mistaken, is it melatonin?
Serotonin.
Serotonin, yes.
Serotonin.
Yes, 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 yes. So it works interchangeably. So when you have when during the day, cortisol level rises up, is a wake hormone. Then during the night, serotonin level rises up. Now, in a case where you are stressed out, you have anxiety, you're overthinking, you're worried, you're anxious, you see that your cortisol level will rise up that period and you find it difficult to sleep. And when you have too much cortisol in your body, it affects your hormone. It plays a role in a lot of things because this is a hormone that from the hypothalamus. I can't explain everything now. From the hypothalamus and everything, this thing. So it's the hormone is not supposed to be too much on your body. So it regulates a lot of things. When it's much in your body, it causes a lot. So stress can play a role on insulin resistant and having insulin resistant. So that is why having an adequate sleep, at least aim for at least 6 to 7 hours, 6 to 7 hours every day, every night. Some persons cannot sleep up to 4 hours because you see them they go to bed around 12. Before 4 o'clock, they're already awake. So they're already
Also,
awake. Mothers, our mothers, particularly the one that has little kids, are guilty of this. You understand? They don't have time for themselves. They don't have time to rest. That's why I see some of them warm out. So, not stress does not only affect your insulin this thing level. It also affects the way you age. It affects
yeah.
your look. It can make you put on weight because that cortisol, that high cortisol, can
That,
affect your weight.
that's a really key factor because like I remember one of my
Yes.
lecturers emphasizing that she's going through a lot of stress, but when people see her putting on weight, they feel she's enjoying that. She's not enjoying it's stress.
No. Some
It's stress.
persons, you notice that some persons they don't eat much. They don't eat much, but they stress a lot. And when they are under stress, they start putting on weight. The reason why you are putting on weight is not because of food. It's because of the hormone cortisol. Because the body is under panic. Your body is under flight and fight state. Your body is under the parasympathetic state. You understand? So your
Yeah.
body doesn't have time to calm, to relax. So the hormone keeps on spiking up, spiking up, spiking up, spiking up. So that is why some of them develop. You see them having pot belly, adding up, putting that weight you are seeing them having is not a normal weight. It's a kind of weight associated with stress, and such kind of weight can affect their hormone. If you're a lady and you are under constant stress, that type of stress can affect your fertility, can affect your hormones, your reproductive hormones, can affect the way you look. Some of them look even older than their age, all those kind of things. So all these factors plays a role in insulin resistance.
Okay. Um, that's really a great one. But I want to ask because although Sha, there's this you talk about weight, hormones. That is, most people going through insulin resistance most likely will be fat, right? So can it affect a slim person? Because
Okay,
if weight gain is there already, that means slim people should be. I don't know. What do you think?
okay, you have to understand that our body system differs. Okay. And you have to understand that one of the symptoms of insulin resistance is excess belly fat. Either they call it pear shape obesity or whatever. I can't really go into
Yeah.
that, but just know that putting on weight is one of them. And it's not necessary that everyone that has a body weight that is not normal is has insulin resistant, and it's not everyone that is slim that does not have insulin resistance. You understand? What you have to understand is our metabolism. Some persons have high metabolism, while some persons have low metabolism. Some persons' metabolism have the ability to burn more calories, to burn out more fats compared to other
Okay.
persons. You understand? Why some persons they engage in physical activities, all these things help to burn out extra fat, extra calories in our body. So you can still be slim and still have insulin resistance without you knowing. Maybe your own is not actually fat, maybe your own is other form. You understand? Maybe acne, all those kind of. Do you know that when you have all this type of acne that refuse to go, this form of hormonal acne, it also points to insulin resistance. You
Wow.
understand? Because insulin resistance is one of the cause of hormonal acne. So
Okay.
yes, it must not be that if you're a slim person, you must be fat before you have insulin resistance. All this type of hormonal acne that you take, you use different type of skincare, all those things is one of the symptoms. It might not be weight, it might be other form. Might be craving, maybe
Okay.
start having high appetite to eat a lot of things, weaknesses, all those stuff can contribute to it. Or irregular menstrual cycle. Your cycle will come day 21. this month, next month it changes to 28, another month it changes to 30. So all those symptoms are one of the symptoms of insulin resistance and inability to ovulate properly. So that's it.
Wow. Okay, for PCOS you mentioned earlier, does it have to do with bleeding, like heavy periods, PCOS?
Okay, and that PCOS, polycystic ovarian syndrome, doesn't always have to do with heavy period, doesn't always have to do with bleeding. You understand? Now, PCOS is a hormonal disorder where there is high level of androgens. You know what androgens are?
Yeah.
Androgens are male hormones. So in our body, we are not meant to have female, not like female don't have male hormones, testosterone. Female have male hormones, but that type of hormones are not meant to be, like say, too much in a female body. So now in the case of PCOS, they have male hormones more testosterone. So for you to be diagnosed of PCOS, they have at least three criteria you must cross. One is having high androgens, which is having high male hormones. That is one. Another one is irregular menstrual cycle, unable to see your cycle maybe for a specific month. Some can be 1 year. Another one is having polycystic ovaries, ovarian syndrome, ovaries. When they check your ovaries, you have all this polycystic this thing there. So we have to have these three criterias for them to diagnose you of PCOS. So even if
Okay.
so even if you don't see your menses for months, that does not automatically mean that you have PCOS. Because this day and age, some women will just say I have PCOS. You read comment section, almost all the whole sorry, sorry, not all the whole, almost all the girls there are saying PCOS. In my mind, I say,
Okay.
is it how they
Is it that
diagnose?
is it that common?
Or is it that they are misdiagnosing them? Because you have to complete before they diagnose you of PCOS, they have to watch you properly because you might be having other issues that are not related to PCOS. You understand? It might be other issues that maybe you need to correct that is not related to PCOS. Because it's not only PCOS that can cause irregular menstrual cycles. Other problems can generate to irregular menstrual cycles. So
Yeah.
some persons once they don't see their periods from 3 months, 6 months, I have PCOS. That's what
No, this is more
that
common to me. Ladies who have beards, they say,
yes, yes.
you have
Facial
beards.
hairs. Yes,
Yes,
facial
they are
beards.
very hairy. They say, it's PCOS.
Some
Ladies, but
persons
normally they should go through all these tests and scans
yes.
before
Yes,
it's confirmed.
I've seen someone that is very hairy, like a young girl that is very hairy. Not like she has PCOS, but just like it's a gene. You understand? She's very hairy, like her eyebrows everywhere. Having all this hair does not automatically mean PCOS, but it's one of the symptoms. You understand? It's one of the symptoms of PCOS because
PCOS.
yes, all those bells shows that, and someone that has sick voice, all those kind of things, health chairs, even agony. You understand?
Yes,
Agony, all
actually.
those stuff can or is one of also the symptoms of PCOS. So that's
Yes.
it. Mm.
Okay, so like in a recap now, the preventions of insulin resistance. Okay, I
Okay.
think I stumbled on one, said increase muscle mass. And I said, so should I go and start weightlifting or something? Like increase muscle mass can help to make insulin to be more sensitive and then
Okay,
stop.
let me just explain why it's like that. You
Okay.
understand? And let me explain why they say increase muscle mass can help to make your cells more sensitive to insulin. The reason why it's like that, remember when I first explained about digestion and how the body utilize energy, I told you that after digestion, you understand, absorption takes place in the small intestine, then um the glucose is absorbed into our bloodstream. Then the pancreas
Yeah.
releases insulin. Insulin facilitates the uptake of glucose into our cells. Now, when this glucose enters into our cells, you need to understand three things happens. Either our cells utilizes it for energy, or it stores as glycogen. Now, glycogen is stored in our muscle and liver. You understand it? Now, glycogen is stored in our muscle and liver. When you undergo exercise to build muscle, you are indirectly allowing your cells to take that glucose that is in your bloodstream and store it there.
Okay.
You
Okay.
understand what I mean?
Yes.
So
Yeah.
so anytime your body needs it, it can still break it down. I think we call it gluconeogenesis, where the body breaks down what they call it. I've forgotten
Breaks
fat.
down food as to.
Yes,
Okay.
to turn it to energy. You understand? In the case of fasting. So
Okay.
when you
Okay.
gym, you are making your body sensitive, your cells sensitive to glucose, because instead of glucose to be stuck in your bloodstream, it is utilized in your cells. Either your cells are storing it as fat, or they are storing it as glycogen in your liver or in your muscle cells, or they are burning it out as energy, because we need energy every day in our life to do work. We need energy. So that is how it is. So, what's you?
Wow. I'm learning a whole lot here. Okay. We've talked on muscle mass and then restriction, sleep correction. Then how does gut biome, microbiome help in insulin resistance from the intestine? How it helps? Do you have an idea on how it works?
I've not read much on that area, on that aspect, but I think that that our gut bacteria plays a role. In fact, our gut during my university days, my lecturer will always say, the gut is the second brain. After
Ah,
this
that's
brain,
true.
yes, yes.
Normal
After
brain.
this brain you see here, your gut is the second brain. That is why someone that has colon cancer can easily die than someone that has breast cancer.
That's true.
If you check the rate of people that develop colon cancer, maybe at they don't even if they detect it early, either they have to cut off some part of their stomach or some part of their intestine to make sure that they live. That is how serious our gut is. It's called the second brain for a reason, because it controls even the brain. I
That's true.
can't actually remember the pathway now, because I've not read that area. It has been long. I can't
But
actually remember the pathway now, but
as long
it
as
controls.
it controls, as in it works on the nutrients that is being sent to the brain, then it controls the brain in the long run because the brain can't do without
Yes,
the nutrients. So
yes.
it may have its unique pathway.
I think the gut produces a hormone. 99% of this hormone, serotonin, is produced in the gut. If I'm not mistaken, but I'll check it out after this live. It's produced in the gut. So a certain kind of hormone, is it dopamine? Let me not just digress. You understand? So the gut produces a certain kind of hormone that regulates our body system. And what we assimilate plays a major role on how our body responds. So the gut also is one of the ways that someone can develop insulin resistance. You know that digestion happens there. Everything about human resistance pass through the mouth
The
to our
mouth.
body. So thank God for the stomach. We just have to thank God for the stomach, because of the hydrochloric acid that helps to neutralize
Yeah,
the
yeah.
some kind of things we consume. Some persons don't even realize how serious or how dangerous hydrochloric acid is. An acid that can burn an iron. I,
Is
I don't know if
existing.
you understand.
Yeah, yeah.
Hydrochloric acid has the ability to melt an iron. That is how, will I say, strong the acid is. So that the stomach has a lining that protects it. That is why when that lining is punctured, you see people complain about stomach ulcer and the rest. So this our gut plays a role in a lot of things because hormones are produced there. It controls the body on its second brain. So that is how it is.
Okay, thank you so much. There's this, I think in one of my research talking about food now, certain
Mm,
foods that contributes to insulin resistance when you take them so often and
mm,
within a shorter periods. And they emphasize on fatty meals. Now, fatty meals take a long time to be broken down, and
yes.
because of that, they keep the insulin high, and then you didn't even give a space. So, would we advise intermittent fasting? Kind of, I know some people that don't take breakfast, why some believe that if you don't take breakfast you have brain fog, something like that. So it
Okay,
didn't.
let me say something about this. For you to control insulin resistance, you don't actually need to fast. You understand? Me myself, I don't really, I not like I
You did
don't
not
fast,
fast
but
this January, but you did not fast, I see you.
I like my morning food. That just it. I like my morning food. Once I eat in the morning, then it can. I like fast. I like eating morning, afternoon, nights. But just that I don't snack between meals. That is one thing
Oh,
people don't understand. You don't necessarily have to starve yourself to control all these things. Or less maybe because when you starve yourself, you find out that you're putting your body in a state of stress more because your body will misinterpret that form of fasting as stress and also
okay.
releases cortisol.
Wahala.
I'm telling you, I'm telling you, that's one thing. That's the reason why we need
Then
to
the person
balance.
will not lose it at the end of the day, or even come down something.
Fasting is good. I'm not against fasting because when you fast, your body breaks down those glycogen, those stored this thing, those stored fats to energy. You understand? But
Yeah.
fasting should be done in appropriate way. Don't fast as if as if you are punishing your body. At least when if you don't want to take morning food, 12 o'clock is okay. 12 o'clock is okay. You can just take your food 12 o'clock. Eat normal. You understand? Then around the evening, around 6, particularly those that are trying to control their weight. Me, I don't have any weight issue. I even want to add. I want to add, and funny enough, this body don't want to add. Imagine weighing 55 kg for how many years?
Wow.
I'm serious. I'm serious. Since my secondary school, I'm weighing 55 kg to today. So
Hmm.
I,
Don't worry, you
I
so
didn't.
hard. See,
So
but you know, wait, one funny thing about weight is easy to get, difficult to lose. We are
it
trying to lose
depends.
weight, kind of.
It
But people
depends.
are
There
even
was
like,
a period. See, let me explain something. There was a period in my life. I think during my secondary school period, I was eating too much, and I gained weight. Like I gained. I was fat. I was fat that period. So I was teased a lot in school. They will call me names like this. You're fat. In fact, your body will not contain the door. So I started starving myself. Oh. I started starving myself. I started counting calories. Like before I'll eat, I'll count calories. I'll use my Google. Um two plantain chips contain how many calories? Two
that's serious.
I'm being serious. I'm being serious. Sometimes at night, it gets to a point that if you give me a fried chicken, because I like chicken a lot. If you give me a fried chicken that period, I will not I will not want to eat. I will only eat apple. Sometimes I'll just take one apple at night and just eat. And funny enough, it helps me and I reduce weight drastically. Like the way so you have to understand that some persons have high metabolism while some persons
Okay.
have low metabolism. Like for me, I have high metabolism in the sense that I can eat and eat and eat without
Mm,
gaining weight easily. Why some person
okay.
they can just eat a little bit, but their body cannot easily burn this fat out, cannot burn these calories out. So that is just the difference. You understand? Having high
Yeah.
metabolism and having low metabolism. So if you see someone, you might put a portion of the same portion of food with someone that is slim and same portion of food with someone that is fat, and you realize that that person that is slim that is even eating more than the fat one, it's because of their metabolism. Their metabolism, they have high metabolism to burn calories more than. So that was how I
Yeah.
was able to lose weight. And funny enough, since then I've been trying to gain weight. I've not gained weight since then.
Um, well, I would like to say I have low metabolism because I don't eat much. I've been fasting. For the
Seriously.
started the year with 3 days dry fasts. Now I'm still on the fast, 40 days fast. But
Hmm.
I check the scale and I'm angry because I'm not jumping. I'm not jumping.
See,
Like I'm almost
see,
very close
if
to
I should
70.
undergo 3 days
And I don't want.
fasting,
I used to be on the 55. Oh. So at
eh,
some point I was even very sick at some point. So I was 50. Then I came up 55. But now I'm almost going to 70. And it's really affecting me because kind of I feel like I'm dragging my body to move. It's not my
it shouldn't affect you. You should check on what's not just fasting on, also what you eat and how stressed you are. These two can also affect the way your body lose weight. And don't stress yourself too much. It's not everybody that will be, will I say, skinny. Some person wants to be like Korean Korean model. And funny enough, do you know that that period I wanted to lose weight so badly? I was not that fat though, but I know I was adding weight and people were teasing me. I was watching Korean movie. I don't know if you watch Korean movie before. You see how their girls are. You
yeah.
know this iron cup, this regular iron cup. I don't have it in the kitchen. I would have brought it. I will use it to be measuring my lap because these girls, their laps is just like this, like this. I'm not talking about leg, laps. These Korean actors and
They are
actresses,
very, very skinny. Yes, they are
yes,
very
very
skinny.
skinny. So because of the way I was addicted to that, watching all this K drama movie, this spirit of losing weight entered me. I started starving myself. I can eat two cabin biscuits in the morning as breakfast. Is that serious? Is that serious? I wanted about me, but once I made up my mind to do something, there's nothing will change it. I can eat two cabin biscuits in the morning. Then I'll eat it and go to school. Till maybe 2 o'clock when I come back, then I can eat one plantain. Is that serious? Then at night I'll eat is it apple? It was an issue.
You were really starving yourself. Even nutritionally, it's
Yeah,
not balanced.
exactly. It was an issue then, and thank God I stopped such kind of thing because it might even result to is it anorexia? You know, that kind of
Yeah,
condition where because I was so slim then, lanky, all my clothes. To a point that people started asking me, they sick? The same people that we are
yeah,
saying, they fat, they go boss. The same people that started asking, they sick? So in this life, you have to understand anything you do that people will talk. So just eat your normal food. You don't have to
yeah,
starve yourself. Eat healthy, eat your normal food. One thing we have to understand in this part of the world that we eat more of carbohydrates. We don't balance our meals. Like if you are eating your rice, you should adapt. That's why I like eating fried rice more than eating rice and stew. The reason why I like eating fried rice more than eating rice and stew is because of fried rice. You have your veggies there, your cabbage, your carrots, your bell pepper, your green pea, all those things helps. As you're eating it, you know that you're eating something well. Like the way your body will digest it, will not digest it as if it's ordinary carbs. But when you
yeah.
eat just rice and stew,
White
you see
rice.
that sometimes it will even take you time. You're hungry again.
It's
Because the
true.
simple sugar your body can actually digest. If you have noticed very well, When you eat beans, your body tends to hold on to that food. You don't feel hungry immediately than when you eat rice. The reason
That's
why
true.
it's like that is because beans is complex sugar. That is oligosaccharides. The body needs to break it down, break it down, break it down. But when you eat simple rice, is it just simple carbs. Your body can easily break it down,
Break it
and
down.
yeah. So that's
You're hungry again.
exactly,
Wow.
exactly.
So, so much land. Thank you so much. I don't know
Mhm.
whether I see you one day, but I don't know if you're close to me. I'm in Port Harcourt.
I'm also in Port Harcourt. Where are
Wow, that
you?
we meet one day, Woji.
No problem. I stay around Igrita.
Okay, it's not far now.
Eh.
My headquarters church is there. Okay, let me even use that opportunity to invite you. My Geo is coming to Port Harcourt live. Oh. Our Geo, because you are still part of us no matter
I don't
what.
want to go.
It's coming live, oh, so come around at Rumuda.
Seriously, no, no
You
problem. I'll
understand,
see
check
to it.
it
I'll
well.
see to it. I'll
Okay.
see to it.
Thank you
Yeah.
so much. I really want to go out for publicity. I was asked to moderate them.
No problem. So should be I ended the life now, right?
Yes,
Okay.
ma'am.
Thank you
Thank
so
you.
much. Anytime you have chance, it was
Yeah,
a
thank
pleasure.
you. I really appreciate you.
Thank you. Bye.
Yeah, bye.
Mm.